Herzlich willkommen. A very warm welcome to everybody out there on their screens. My name is Jakob Simmank. I'm head of the health section at ZEIT Online, and I've been covering the pandemic from early January 2020 on. And today we will be hosting a panel about the response of the pandemic, about its global differences, about its shortcomings and inequalities, and of course about what lessons can be learned from the response to this pandemic. I'm very pleased to welcome a fantastic panel, a panel that is indeed very international in its scope, in its view on the topic, and for this reason I'm pretty sure we will have a good time. Before we kick off the meeting, please use Slido to hand in any questions at any time. I will come back to questions later on. And for now, I will start introducing the panel. Our first panelist is Philippe Duneton. He's Executive Director of Unitaid, a global health agency that is engaged in preventing, finding and treating diseases such as TB, HIV/AIDS, malaria, and recently also COVID, especially in low and middle income countries. Dr. Duneton is a doctor and holds a master's degree in public health. He has practiced as an infectious diseases specialist in Paris, led the French Regulatory Agency for Medicines and Health Products, and has chaired the board of the European Medicines Agency. Good afternoon, Dr. Duneton.
Good afternoon. Thanks for having me.
Thanks for being here. The second panelist is Fiery Woods. She is founding dean of Blavatnik School of Government and professor of global economic governance at Oxford University. She holds degrees in economics and international relations and focuses on how to enhance the governance of organizations, the challenges of globalization, global development, and the role of international institutions. She sits, among many other things, on the advisory boards of the Center for Global Development and the African Leadership Institute. In 2020, she joined the Lancet COVID-19 Commission. Hello, Professor Woods.
Hi. Lovely to be here.
And the third panelist is Elhadj. C is co-chair of the Global Preparedness Monitoring Board, initiated by the World Health Organization and the World Bank. Before that, he has served as the Secretary General of the International Federation of Red Cross and Red Crescent Societies from 2014 to 2019, and as a member of the Global Health Crises Task Force that was initiated after the Ebola crisis in West Africa. C studied arts and human sciences at the University of Dakar and arts and Germanistic at the University of Graz. He has also graduated from the Diplomatic Academy of Vienna. Welcome, Elhadj.
Thank you for having me.
Before we come to the panelists, there's a fourth panelist I have to introduce, but she's unfortunately not here in person today and will send us a statement. The fourth panelist is Stella Kiriakidis. Since 2019, she's the European Commissioner for Health and Food Safety. Before that, she worked for the Ministry of Health of Cyprus and as a clinical psychologist for children and adolescents. She holds degrees in psychology from the University of Reading and a master's degree in child maladjustment from the Victoria University of Manchester. And she's a member of the Conservative Democratic Party. Please, the statement from Stella Kiriakidis now.
Ladies and gentlemen, Time for Science is a very accurate title in unprecedented times where the role of science and scientists have been more important than ever. And I am honored to address you today. COVID-19 has reminded us that we live in a truly interconnected world, that our health depends on the health and well-being of our neighbors, that overcoming the pandemic requires solidarity and cooperation. These timely reminders have driven the European Union's COVID-19 response and defined the EU's global action. Last year, European Commission President Ursula von der Leyen launched the coronavirus global response, which has raised nearly 16 billion euros in funding for universal access to affordable vaccination, treatment and testing. This required determined cooperation with key international partners such as the World Health Organization, Unitaid, the Wellcome Trust, and many others to boost global pandemic preparedness. Together with our partners, we have set up the Access to COVID-19 Tools Accelerator and COVAX, the Global Vaccine Alliance, which is providing low and middle income countries on a daily basis with much needed vaccines. We have also led the coordination of European and global research efforts, including our preparedness for future pandemics. And right now, member states, including Germany, are pooling resources through the EU Civil Protection Mechanism to offer India much-needed support. We have also seen EU member states show remarkable solidarity with one another. They have shared medical treatment, supplies and personnel. They have cared for each other's patients. They have worked together to repatriate stranded citizens. But perhaps the best example of European solidarity in action is our vaccine strategy. So far, we have secured access to over 2.6 billion vaccine doses from 6 vaccine manufacturers. Today, vaccination campaigns in Germany and across the EU are speeding up, with over 150 million vaccines administered so far. However, we must go even faster to reach our goal of vaccinating at least 70% of the adult population by the summer. To that end, a new task force will work to eliminate bottlenecks and to accelerate, upscale, and adjust vaccine production to virus variants. Also, we are very close to concluding a new contract for BioNTech-Pfizer vaccine doses, foreseeing up to 1.8 billion doses for the coming years. As I suggested earlier, universal access to safe and effective COVID-19 vaccines must be part of any long-term global solution to the pandemic. We, from the very beginning, supported global collaboration through the groundbreaking COVAX initiative for fair vaccine distribution. Acting with its member states as Team Europe, the European Union has contributed nearly 2.5 billion to COVAX. Ladies and gentlemen, the situation in India today shows us how crucial international solidarity is to tackle global pandemics like COVID-19. Last year, the German EU presidency did much to strengthen our unity of purpose on so many fronts against the pandemic. Building on that unity of purpose and to better prepare us for future threats, the European Commission has come up with a bold plan for a strong European health union that puts our citizens' health first. It goes without saying that science, research, and innovation will play a key role. With that in mind, I wish this year's ZEIT for Science event every success. Give more time to science. Thank you.
Many thanks to EU Commissioner Stella Kiriakidis. And I'd like to relate to this statement directly with you, Dr. Duneton. Stella Kiriakidis mentioned India, and I think India and its neighboring state, Nepal, are indeed very, very vivid examples of what happens when SARS-CoV-2 rampages through society. But it's not only that. I mean, we're also seeing that there is a shortage of supplies, for example, oxygen in many places. We see people outside hospitals that cannot be treated. What is it? How do you see these pictures as someone who's engaged in trying to supply these sorts of things?
Well, as you said, it's a big challenge. I think that it reminds us also to be careful. The fight against the COVID-19 needs public health measure. And of course, we need to be very careful. It means that in some form of social distancing, with masks, until we have a sufficient vaccine coverage. So we need public health measure, access to vaccine, access to therapeutic, and in the therapeutic, access to oxygen and corticoid. As a member of the therapeutic pillar with the Wellcome Trust, we are working on that. And of course, the point is that basically in a lot of countries in the South, you have a chronic issue in terms of access to oxygen. And we have been working before the COVID-19 to try to push access for O2 because it's needed for children, women, traumatology, whatsoever. So it's a key element that is not available everywhere. Mm-hmm. But of course, the situation with COVID, it increased the need in terms of O2 because in terms of therapeutic, in association with corticoid, you can decrease the mortality by half, basically. And of course, when you are facing that kind of surge, it's very, very difficult to shift the production because you have, in India, for example, a lot of industrial production of O2, but it's not medical standard. Mm-hmm. But there are many challenges in terms of oxygen. We have assessed the capacity and availability in a lot of countries with a huge partnership with WHO. And it's a key element that needs a global supply, local production, but also technical assistance. This is a key element that is missing a lot. And we hope that India will go through, because India has the capacity in terms of production. But the key issue we can see is the distribution in the middle of the pandemic, which complicates things. But for sure, O2 is a key element to fight, of course, COVID-19.
Let's take one step back. Your work is, you're working with other agencies, establishing something that's called ACT Accelerator. Could you, for all the listeners who are not aware what that is, outline a bit what your work is and why it's so necessary right now?
Yes. So ACTA is the global initiative that was launched in particular with the support of the European Commission and countries like Germany, France, and others, to organize the response at the global level. So it's clearly articulated with WHO, but we have 4 pillars, one in terms of vaccine, and the commissioner mentioned COVAX, which is the global facility for purchasing vaccines for LMICs. We have another pillar with therapeutics, which I co-lead with Wellcome Trust. And we have a specific pillar with FIND and the Global Fund in terms of diagnostic. And the last one is on health system. So instead of creating a new agency, we pull out our specific skills to organize the response. Of course, it's a big challenge because we have to learn every day, and we have been challenged. We have the good news with the production of vaccine that was real, and of course we have many vaccines with several challenges, but at least the production is there, and it will have to increase in the coming weeks and months. In terms of therapeutics, as I mentioned, access to oxygen and corticoid is something key for the severe cases, but we are working with a network to identify what is the molecule and the therapeutic that will kill the virus at early stage. So we hope that in a couple of months, we may have good outcome in terms of new antivirals and also monoclonal antibody that will have that capacity. The challenge we have is not only to think about the production, not only to think about the access in terms of price, and we can talk about it a little bit later, maybe, but also how to make sure that the countries are prepared to use it. So it's not just to have the medicine, but also to have a plan, to have access to diagnostic, to have an approach and test and treat, because these new medicines will have to be used in the first 5 days of the infection. So there are, as you can see, a lot of challenges. So we have to, let's say, do this global battle, but we need also to make sure that each country is ready and prepared and have access to the right tools to also fight, because global is absolutely key and essential, but the real battle will be country by country.
Okay, so ACT Day basically is the umbrella for COVAX and other initiatives that basically try to roll out vaccines, therapeutics, diagnostics, etc. Is that fair to say?
Absolutely, yes.
Okay.
And that's this organization composed of each of the partners working very closely with WHO needs, of course, resources. And that's why, in fact, we need currently 19 billion to organize the response and also buy all the vaccine, therapeutic, and diagnostic that the country needs.
Okay, thanks for now. Mr. C, you have a really strong experience basically in terms of pandemics and epidemics. I mean, looking back at what you did in your career, seeing this pandemic unfold in 2020, what was your impression? Zooming out a bit, what did prevail overall? Was there a resurgence of nationalism or was there global solidarity?
Well, too early to draw conclusions, but we have a bit of everything right now. Nationalism, for sure, because those who could afford grabbed everything on the market right from the beginning. We're talking about vaccines now, but it started with masks, that is with PPEs, started even with hand sanitizers. Even countries, low-income countries could not access them. And even when they had the money, those who had, strongest purchasing power had taken everything out. So we hope that we could have learned from that right from the beginning and correct the course. Now, research and development, was accelerated, and we salute that. So vaccines have been produced in times that are quite unprecedented. But here again, what we saw, was, the hoarding. What we saw was, pre-ordering. And now today, we have some countries that have vaccines that could cover 200% of their population. And in countries, in the continent that I'm living in, you have about 1 to 2% of the population only having access to vaccine. Of course, this exacerbates the inequities and disparities that we are seeing. So the solidarity is coming in very, very, very few ways, and that are not necessarily the best ways. Vaccines being used as a diplomacy, so vaccine diplomacy, where people are using it to position themselves, geostrategically, and in a number of doses, that are more symbolic, than really making a difference. I can give you a very concrete example. In the country where I live, the first batch of vaccine we got was from China, 300,000 doses of a Sinopharm vaccine. And after a long time, of waiting, in this crisis, then COVAX, 250,000 or 320,000 doses. And now, the country had to order again, from China. So that is a population of 16 million, people. And you could say the same on a number of, other countries. I think there are a lot of talk about solidarity. There's a lot of slogans. None of us is safe until we all are. There is a lot of, talking about, the interdependence, interconnected world within which we live in, but it is not yet translated into action. So the wonderful initiatives that were taken, and then Dr. Duneton was talking about some of them, the COVAX and ACT Accelerator and the like. Well, we salute everything which is being done. It is enough. Is it enough? Absolutely not, in my eyes. And even the needs, the financial needs of those initiatives are not met. And so solidarity is definitely lagging behind.
You're saying not yet. Is there hope that this will change in the upcoming month? I mean, at least we're seeing basically vaccine coverage that is rather high in rich countries, which at least opens up the possibilities to donate vaccines.
Yes, that's true. But again, in a pandemic, we salute that those countries have a responsibility to vaccinate their citizens, and rightly so. There is nothing wrong, about that. We should care of all citizens of the world, including the ones in the richer countries. But in a pandemic, if you want to wait until you vaccinate 100% of your citizens to care about the rest of the world, then that is not the best way to fight a pandemic. It may be more effective, to run in parallel a high coverage, of course, in their countries, which is a legitimate thing, but at the same time, participate actively at a scale and magnitude that is required, that we have also a level of coverage that will be containing and fighting this pandemic effectively. We're not there yet, and we hope that we will learn, from the experiences of the last month, and then try to correct the course moving forward.
I put a pin there because we will later on talk about what needs to be done right now and what needs to be done also maybe for preventing and then treating the next pandemic. But for now, let's look back one more time. How do you make sense of the fact that certain countries fared very well during this pandemic while others didn't really? I mean, and that's not really a question of income level. I mean, looking at poorer countries, many African countries fared very well. Vietnam fared very well. And then if you look at UK and US, the per capita death is very high. How do you look at that as someone who's experienced with epidemics and outbreaks?
Well, we know that complacency, is not very helpful. We know that denial is not good either. We know that a leadership that is not basing its decisions and communication on real data and science, doesn't help. We know also the trust in the leadership, matters. So those countries, that have not fared well, we find a combination of that: misinformation, complacency, denial, lack of true leadership to carry forward a program or an initiative or actions that are based on data and science. And the countries that fared well learned from past experiences, of responding to epidemics, like some of the African countries. Others, like New Zealand, Vietnam and others, the level of trust in leadership and the courage to take on very early the courage to address, this epidemic, taking on public health measures, that are not necessarily the most popular one and the easiest one to take. Lockdowns, social distancing, accompanying, people with supporting them, with social safety nets so that they can cope with the kind of economic hardships they were experiencing, end up doing, quite well. And those are the lessons, that we learned. Leadership matters, trust matters, involvement of communities and societies, to follow, those very difficult public health measures in very difficult contexts, will make a difference.
Okay, thank you. Professor Woods, I kind of want to ask you the same question as someone who's really experienced or having this view on governance as well. How do you make sense out of this mosaic picture, one could say, of the world, basically parts being very good in tackling this pandemic and other parts having a very poor track record? I can't.
Sorry.
Okay, there you are.
There we go. Here at the Blavatnik School of Government at Oxford University, what we did is we set up the Oxford Government Response Tracker, which has literally tracked the government responses of almost every government in the world using an amazing network of volunteers. And I think what comes clear out of that is that some leaders began by asking, some politicians entered this crisis thinking, what can I afford to do politically? Like, what can I do and keep my own party on side and keep a proportion of the population on side? Others came at this crisis, a small minority, saying, what do I need to do to protect my community, which might include some unpopular measures? That starting question was important because those who said, what can I afford to do politically, were too slow to lock down, they were too slow to make test, trace and isolate work, they were too slow to impose travel restrictions. And then once they realized they could lock down the population, they did, and they wasted the lockdown time. They didn't use every minute of the lockdown time to put in place the measures that would permit them to open up much quicker. So to me, there are both lessons about, I think a crisis reveals great leadership or not, as the case may be. And we saw too much politics intervening in too many political leaders' minds.
You wrote in a piece that there's basically a pattern of politicians looking more at popularity than basically at the pandemic, and that's what you mean by that, right?
Yeah, but I also think there's a question of, in a situation of uncertainty where you're unsure of whether this pandemic is going to hit you. And of course, many politicians thought, well, Ebola, SARS, MERS, they didn't affect us, so why would this? In that situation of uncertainty, do you want a political leader who says, I might just survive without doing anything, like we could be lucky? Or do you want a politician that thinks about the worst case and prepares for it? And I think this pandemic shows that you actually want a politician that prepares for the worst case.
That's interesting because I had a look at the Global Health Security Index that's been put out every year or every 2 years by the Johns Hopkins Center for Health Security, and looking at basically the index of 2019, the UK and the US score very well on this index. Basically, what they were doing is giving themselves good marks for their preparedness, and it turns out these countries are, in the end, the countries with a very high death toll per capita. How do you explain that? I mean, the countries who were supposedly the best prepared fared very, very bad during this pandemic.
So to me, it underlines why we absolutely have to learn from this pandemic, because in a way, the fact that they thought that they had all the resources to make this possible, lots of hospitals, lots of healthcare provision, well-resourced economies, meant that instead of feeling they needed to build fences at the top of the cliff, to stop people getting sick, they thought they could rely on their hospitals to kind of pick up and treat everybody that fell off the cliff. And soon their hospitals were completely overrun. I think what we need to learn from the pandemic is how to structure decision-making in such a crisis so that you're not blindsided by political expediency on the one hand, by the natural human bias to hope that everything's going to be fine because the bad case scenario is too awful to contemplate, and not to have a complacency, not to presume complacency. I think for the Global Health Index, and of course, Dr. C will have much more to say on this as head of the Global Monitoring Board, but I think it really did show us that there are things missing in our understanding of what it takes to be pandemic prepared. And in that pandemic preparedness, the role of leadership, of clear communication, and of a connective governance, which brings all parties to the table, were perhaps underplayed in both the joint evaluations that the World Bank had sponsored and in the Global Health Security Index.
Do you want to maybe jump in there, Elhadj? I mean,
yes, indeed, building on what Ngaire said, the resources that one has or the capacity, the strengths of the infrastructure are not necessarily the good indicators of preparedness. It may be a good indicator for response, but not necessarily for preparedness. And what really will make the difference in preparedness are those issues that we talked about. The quality of the leadership, how active the citizens are to hold their leaders accountable, how data and science are guiding decision making, how trust is built and strengthened between leaders and the communities they lead. So we will have all to learn a little bit more and better. And I think the lessons that we are drawing from this current pandemic, will help us, better define, what will be those benchmarks and those criteria for preparedness, looking forward.
So just a quick interruption there. Any questions you have, just send in via Slido. We'll come back to them later. So far, I don't see any questions, so I hope you contribute a bit more in the next few minutes. Coming back, because we already touched the topic about lessons that have to be learned, basically, in the very moment to curb the damage the pandemic will do still, in the coming months and years, possibly. But also lessons that can be learned for preventing or basically fighting the next pandemic. What is necessary in this very moment to do? And this goes to Dr. Duneton first, but I want to make a round so every one of you can maybe highlight a few points you find important. But starting with Dr. Duneton.
Yes. No, thank you, and thanks for my colleague, because they speak the truth, and I think there are a lot of lessons learned. One thing that we need to be aware of is the COVID fatigue. We have all the COVID fatigue, by the way. But the danger of that is we want to go to the next phase. And we need to be very careful and based on the data. So, of course, everybody have to release the progress in terms of vaccine coverage with the limitation that it's not happening so far in the South is absolutely serious. But also to be absolutely clear on the fact that we cannot jump from a lockdown to something too fast, to the new reality too fast. So it's absolutely a key element. It's not easy, but I think it's a first lesson learned. The second is in terms of access. ACTA is organized around equitable access. It means that the product that we need should be available not only in the north, but also in the south, and with the hope that at some point in the same pace. We see that the limitation in terms of funding, but also in access provision. I will take a very simple example. I was talking about the new medicine that should come in the coming month to treat early phase of the disease. But we know already that the pharmaceutical company, are okay to discuss for the low-income countries, but they don't have a broad approach. And of course, we need to have access to medicine in Africa, but also Latin America and also Asia. So it's a response for the world. So we need to think about how we can use the instrument we have. And for example, the Medicine Patent Pool is an organization who can deal with the IP license. And we know that because we discuss with generic manufacturers, and they can produce, if it turns that we have the efficacy, really rapidly. But we need access to that license, working with the Medicine Patent Pool, to expand the scope. This is clearly something that is important for this pandemic, but it will be also key in future response.
IP is intellectual property, just for the people who do not know the abbreviation. Yeah, no worries. You said there's a gap in funding. Could you give us an idea of how huge the gap still is?
Yes. So, I mean, part of the work that we have been doing is to also look at what is needed for the response. And of course, is to pay, for example, for the vaccine, but also to push the industry to develop the right tools. So again, the gap in finance, and I will be more specific, it needs to be understood also as if we don't move now, we will take much more time to get access to the right tools in the countries. And that's the situation we have with the vaccine, for sure, with the competition between the North and the South, absolutely with my colleague on that. But so globally speaking, the response need 28 billion. So far, the gap remains at 19 billion. And last week, you remember the high-level panel on COVID response has issued a report, and they call for filling the gap as soon as possible. So we hope that discussion with the G7, discussion with the G20 will help to close that gap, but we need that as soon as possible. And it's really, again, I know, and we know that it's a lot of money. Basically, to have an idea, you can compare that international ODA that is going to global health is more or less the same amount that we need to fight the pandemic. But we don't have any choice.
Yeah. Mr. C, what needs to be done right now, in your opinion, in your view?
Yeah, first of all, I think I fully agree with Dr. Johnson that gap needs to be filled very urgently, and we all join, to make that call. But this pandemic also is a multidimensional, and its response has to be multidimensional. And the funding of it will also be touching, many different sectors that are affecting people. So there are, many people, millions and millions, that have lost, their livelihood. There are many people that cannot, in the different geographies, will not be able to observe the public health measures, that we are promoting, because they will have to make a living over the next day. So the social safety nets, that should be accompanying that needs to also to be funded. It has revealed also how weak and at times inexistent, the health system is in some places, and that financing, needs to happen, very urgently, so that it can really minimize the shocks, that we will have to experience. And I think all of that will have to lead us really to open up into new ways of financing, into putting a system that is multidimensional at the global level as well as at the country level, that will be looking at all those aspects and then trying to fill them. Either we do it now and then reap the benefits, or we don't do it and then we pay much, much more, later, with the consequences. So we not only hope, but we all have to mobilize really to hold all our leaders accountable. Everybody, including even leaders of poorer countries, to invest where it is needed, to care for the citizens, to strengthen their health systems, to prioritize, and also, of course, the global solidarity that we all need, to work it together. So nobody should be left off the hook here. We need also new partnerships that are strong and that are serious, partnership between governments and the private sector. we need a greater involvement of the private sector. The international financial institutions need to chip in together with the global health organizations, and then forge new partnerships and a new form of accountability mechanism be put in place in the lines that the IPPR report is suggesting. That is all of that I think that will take us to the next level where we can be better prepared for the further shocks and hazards that inevitably will be coming on our way.
In your report last year about the pandemic, the Global Preparedness Monitoring Board wrote that basically COVID-19 has taken advantage of a world in disorder, quote unquote. So everything basically trying to, even little steps, trying to basically build order would help, I mean, during this pandemic and against further pandemics. Is that fair to say?
That is fair to say, because we all are realizing that we are in a totally fragmented world. We are also in a world where we think there is a lack of solidarity, lack of coordination, despite all the efforts that have been made, so far. But again, the frustration here is, how can we be so smart, to make a very pertinent analysis of the situation, and so foolish enough not to take the appropriate action, to address them? And this is the challenge we face. I think we've been analyzing and analyzing, we've been recommending and recommending over the years. And there's a lot of deja vu, unfortunately, that will be getting worse and worse. And how can we incentivize, real action and, together take the bull by the horn, and then making sure that, we will be in a much better place when we are hit again, by a shock of this magnitude.
Professor Woods, what's your take on that? What needs to be done right now? I mean, that's always the million-dollar question, I know, but...
Look, humans can achieve what they aspire to, and vaccinating the world is something that humans really can achieve. Let's not forget that just this month, humans landed a machine on Mars that could make oxygen. We can vaccinate the world, and I agree with both my colleagues that has to be the case. A second thing, though, that I would point out that I think is an important lesson is how important the local level is and local trust is. That the world has learned at great cost that great big national test and trace systems or vaccination systems don't work very well because the public need to trust the person who's giving the information. And I worry that this is being ignored. If we look at the history in global health of onco, of leprosy, even HIV, AIDS and ARV treatments, the local is really important, and that's where investments need to be made. Let's not forget that the next pandemic might not have vaccines. So let's not all focus entirely on vaccines. And I think the third lesson is that the science of communication needs more attention by policymakers and by health professionals. For example, human beings respond extraordinarily well to the positive. In other words, by telling them that by wearing a mask, they can win freedom, rather than saying, if you don't wear a mask, you won't be allowed into shops. These differences really matter in shaping human behavior. Similarly with vaccines, saying to people, if you have a vaccine, here are the things that you can do. So I think there are lessons about communication that we now need to apply as well.
I mean, building trust is incredibly difficult, right? I mean, you all stressed the topic of building trust. How can you even manage to build trust? I mean, that's something we need to do for years and decades, right?
Yeah, so I didn't mean that you try to build trust instantly at the moment of crisis. What I mean is find the institutions that people trust, the local environmental tracing officer, their local doctor, or in Britain, they're rolling out vaccines in local mosques, in local churches. Instead of saying, we will come in brandishing our brand, they're saying, who do we know this local community trusts? And how do we work through those people to reach people, either to tell them to isolate or to take the vaccine?
And I mean, it's a point you sometimes make is that...
That is indeed a very, very important point. I think building on local communities is really key. Pandemics start in communities, it will end in communities. And being there before the crisis, supporting and accompanying communities during and remaining thereafter is that continuum, that will be strengthen the trust and then the greater involvement, of it. And that is the reason why we all call for these necessary partnerships to be built and strengthened. And I think the role of communities will be critical moving forward, as always.
Yeah, that's a very good point. It's something you also stress, Professor Woods, is that there's not always a good tissue between different levels of governance, right? National, subnational, local, basically. So we need to think about basically building this tissue, as you call it.
I think that's right. Look, sitting in Europe, what struck me is that these are countries whose last big crisis was a financial crisis, which you can pretty much govern from your capital city, tell people what to do. And that left them, or terrorist crises where you get the same thing. And that left them very poorly equipped to understand that this crisis required a much more intense local connection. Three things are required for that connective tissue. The central government has to share data with local entities, with mayors, with local governments, with local states. So there has to be a trusted sharing of data. There has to be shared decision-making instead of having decisions made at the center and imposed on localities. And there have to be shared resources. And I think the countries that have found themselves in difficulties, either in phase 1, 2, or 3, are the countries that just haven't had the trust and the connective tissue between the central government and much more local government.
Very good point. I want to turn now to the questions of our listeners. The first one, and I just play it into the round of you three because I don't know really for whom it is. What role can law play in regard to preparedness and response? Or do you see law rather in terms of limiting preparedness and response? Is there anyone who feels he wants to answer?
Well, it depends how law is used. So, and I think if it is a positive reference, to the law, to aspire, for the well-being, of people, while minimizing, any negative impact and effects. That is certainly, a good thing. But we can also see in some situations, that authoritarian regimes, referring to the law to restrict liberties, postpone elections, restraining even some democratic processes, in the name of the law. And again, it just depends how it is, used. I think a, positive enforcement, in order to facilitate access, a positive enforcement in terms of accountability and good governance, all those, can be referenced, to the law and then contribute to a better response. By the contrary, could definitely be a bottleneck.
Maybe to add to that, I mean, last week, the independent panel that was summoned by the WHO, World Health Assembly last year, they also came up with a lot of propositions, basically, to change international law to make pandemics more of a priority, so to say. Is that something you would welcome?
Yes, we welcome the recommendations, of the report. But again, for international law to take primacy over national law, you need also a leadership. You need your compliance. You need a collaboration, and then you will need a ratification, to make it enforceable at a national level. And again, we come back, to the leadership that is required, the political commitments, that we need, and this multilateral platform that will be bringing everybody together, in form either of a treaty, like what we are talking about, right now. But again, you can see the ones that are the great promoters of the law when it comes now to have international conventions and treaties resisting that very strongly in the name of national sovereignty. So we need to learn, all of us, with a great level of humility, the lessons of this current pandemic, be generous enough to open ourselves to our common goods, and then see what are the necessary adjustments you have to make within the national borders, as well as within the international commitments.
There's another question regarding the indirect consequences of the pandemic. For example, lower utilization of diagnostic and therapeutic procedures for cardiovascular diseases, type 2 diabetes. More of a question for the developed countries. Is it something people, I mean, that's kind of a bit of a different aspect, but is it something we look at enough at, basically? So the collateral damage of the pandemic? Maybe to Professor Woods?
Look, there has been huge collateral damage, both in wealthy countries and in very poor countries, where at risk are really basic health needs, maternal health care, malaria, ARV treatments, where people have lost their livelihoods and there is no support for them. So they literally are starving, and therefore they can't take their ARVs even if they've got them. So I think the collateral damage is huge, and part of the world coming together to build back after COVID has to be thinking about how to resolve the humanitarian crises that are quietly exploding because of that.
One more question. One listener asks, 19 billion US dollar doesn't sound too much if you compare it to the pandemic's economic costs so far. I think that's a very good point here. Professor Woods, how can such financing be better organized so it doesn't have to rely on mere charity?
Well, so firstly, it really can be. Put simply, government finance, by pooling finance together, by pooling the risks that any one government faces, the world can create a big credit pool that countries can use so that the world can grow together out of this. They did it after the Second World War, and they can do it after this crisis. That's why the world created regional development banks, the World Bank, the IMF. It's not magic money. It's just exactly the same as you buying an insurance policy for your car. It's pooling the risks of all countries and then distributing that finance so that all countries can grow out of it. And the world knows how to do that. It's done it before. And the world also knows the perils of not doing that. The perils of not doing that are that if you leave out too many countries, you can't grow because there's no other countries that are buying what you're producing. If you leave out the poorest countries, they become places which pose a great danger to you. They become transshipment points. They become places that incubate terrorism. You know, even if you don't care about the people in those countries, you should care about your own security and care about what happens to those countries after this crisis.
Okay, so many thanks to all of you for this very interesting panel. I find we spoke a lot about accountability, about good governance, about trust, about what is currently needed and what's needed for the future. And so big thank you for you three for joining us today and for patiently answering the questions. And all the best for you. I will turn to German now for a few more announcements and say goodbye to our panelists.
Thank you very much.
Thank you.
Thank you.